have some comments that I've prepared so that I could make sure I said what I wanted to say here. The concern we are addressing today is the spread of this virus from one person to another in our school buildings. We have learned that there are several layers of necessary safety measures against this virus. The first and most effective is vaccination. The second is face coverings. As mandated by state law, the school district is required to provide a safe learning environment for all students. We will fail to uphold that obligation if we endanger the lives of children and their families in order to prioritize individual personal freedoms. There are times when the exercise of our personal freedoms imposes on the fundamental rights of others. In my view, this is one of those times. This school district is a community that is in the habit of caring for one another by sometimes putting others' needs ahead of our own. This is not a new thing for us. The CDC is recommending masks for indoor public spaces for both vaccinated and unvaccinated people in areas with at least 50 cases per 100,000 residents. Arkansas currently has over 359 COVID cases per 100,000 residents. We also currently have the second highest rate of deaths per capita in the nation. Last week we had the most. 70 Arkansans died of COVID last week. There are 24 pediatric COVID patients at Arkansas Children's Hospital. 5 of them are in intensive care, and 12 of them are under the age of 12. Just yesterday, we had 209 new cases in Washington County alone. As the governor confirmed earlier today, Arkansas is in a state of emergency, no matter what data you are considering. As a result, sadly, the state of Arkansas is again preparing for a prolonged remote learning as a potential scenario in the upcoming school year. They're also encouraging the wearing of masks by all unvaccinated staff and students in the school building. They're hoping people will abide by those recommendations because they are unable to require it. That doesn't provide much comfort or certainty to parents of students who are under the age of 12. To have no policy in place to clarify the expectations around face coverings in our school buildings creates anxiety for parents and students who are reliant on this school board to prioritize a safe environment for learning. The Department of Elementary and Secondary Education has also provided guidance around quarantines, which will be much more frustrating for unvaccinated students. They will have to miss school for quarantine if they're exposed to a positive case. Vaccinated students and teachers will not. 94% of our staff is fully vaccinated. This will have a very negative impact on our unvaccinated students. We need to continue finding ways to encourage and incentivize vaccination amongst our students. Local physicians are telling us that universal masking is paramount to ensuring a return to school that is as safe as possible. Not one has told us otherwise. This is not political. It is not an effort to dictate anyone's personal health care choices. This is about protecting children. We have to do what we can to keep kids in school. Mandating masks and continuing to encourage vaccination are our best tools for accomplishing that. I hope that our legislature will do the right thing and amend Act 1002 in order to provide us with the tools that were designed for school boards to use, policies. If not, I suggest we need to intervene in the lawsuit in an effort to lend credence to the concerns of the plaintiffs, and in order to regain our governing authority to do what is best for our community by providing a safe school environment for their children. So, all those in favor, say aye.
Aye.
All those in favor, say aye.
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 All those opposed? Motion carries 7-0.